Good morning, good afternoon, good evening, everybody. Welcome back to another episode of the Global Health Uncensored podcast. Today's podcast is special. We have two special guests who are really trailblazers in global health join us for a very insightful discussion. Our first guest is a prominent figure in global health. He currently serves as Assistant Director General at the World Health Organization. He leads the WHO's work on pandemic and epidemic intelligence, which includes initiatives related to global surveillance, preparedness, and response to health threats. Prior to WHO, he was the Director General of the Nigeria Center for Disease Control, where he played a crucial role in the country's response to public health emergencies, including the COVID-19 pandemic. His career has been marked with significant contributions to public health, especially in Africa and globally. Um, his expertise and leadership in these areas have made him a respected voice in global health, especially in the context of epidemic preparedness and response. Our second guest is also a well known public health expert and the managing director of Nigeria Health Watch. She has extensive experience in health communications, public relations, advocacy, particularly in Africa. She's recognized for promoting public health awareness and shaping health policies through effective communication strategies. She has held leadership roles in various organizations and is known for bridging the gap between technical public health knowledge and accessible, impactful messaging for diverse audiences. She has contributed to efforts aimed at improving health systems and increasing public engagement in health related issues. I'd like to welcome my special guest to our program, Dr. Chikwe and Vivianne. Dr. Chikwe and Vivianne, thank you so much for joining me. I'm really excited for this conversation, and I'm hoping that my audiences would also be excited to hear from you and the amazing work that you've been doing for the world and Africa in particular. So welcome to my podcast, the Global Health Uncensored.
Great to be on your show, man, and thank you for the work you're doing. Actually, great job sharing thoughts and thought leadership with the world.
Pleasure to be here too, Banda. Really lovely to be on your podcast.
So I guess we'll start from how everything unfolded. Can you both share some stories from your early life and how those experiences have shaped your career till now? Um, Let me start with Vivian.
Okay. Thank you for that question, Banda. That's a really interesting one. How did my early experience shape my current career? I think for me, my previous, experiences, which, saw me living in different countries at a very early stage, exposed me to different cultures and living with different contexts and different people. And, the nature of public health is having to engage with the public, having to find those commonalities to, for instance, communicate. Something that is a focus of my work. So I think my early career kind of shaped an understanding and appreciation for learning to live and dialogue with different people. And I think in public health communications, that's a very important aspect of ensuring that you're able to engage with people with whatever public health message that you're trying to disseminate. So I think for me, my early experience kind of shaped a lot of how I see things and how I view life and the world right now.
Okajikwe, how was your early experience like?
I think, like most other physicians, you train to treat the patient in front of you, and that's kind of what you're preparing for. And that was the journey I was on until through a set of circumstances, and I described that in the book, which your audience will read. I
Mhm.
got distracted and went into public health, really to as a stopgap measure, right? Than to continue on the clinical path. But I think what I really enjoyed with my early exposure was this uh, complex, challenging problems. In clinical medicine, yes, some things are challenging, but many things, if you make the right diagnosis, you provide the right set of, uh, uh, you know, resolutions to whatever the challenge is. Most of the time, you either have an improvement or you don't. There's a linear path or not. But with public health, there's so many different factors that influence an outcome, and I love the complexity that brought into my own development.
Yeah, I kind of understand that perspective a little bit, and I know how the clinicians also have a different perspective about public health physicians. When I told my one of my professors back in medical school that I'm interested in public health, he said, "Why am I looking for the easiest path?" So they also believe that public health is like, oh, you don't want to, you don't want to take
It's
on a
easy.
challenge, but
Not.
it's more challenging being in public health than the straight path, as you rightly said. Um, Miss Vivian, I know you've been in leadership position for a while. What are some of the challenges that you've encountered as a woman leader in public health, and how have you gone through them successfully?
Okay, I think for me, being a leader, a female leader in any context, I think the context in which you operate makes a difference on how you're able to, do your work. So, for example, my organization, Nigeria Health Watch, is based in Nigeria. And one thing we see often is a lot of the health challenges that we face in Nigeria disproportionately impact women. But unfortunately, in a country like Nigeria, a lot of women, you don't often find them in leadership positions. So what you often see is that health policies don't often listen or integrate the perspectives of women. So, in the health sector in Nigeria, we don't have enough, or we don't have enough women in those leadership positions to be able
Hmm.
to have that direct influence on health policy. I'll give you an example. Recently, the violence against public persons was is currently being reviewed in the Nigerian House of sorry, Republic. So what that has seen is that suddenly a law that has an impact on domestic violence or how women are able to seek recourse is looking to be repealed. There wasn't any consultation. The people who make those decisions are not women. So as a woman in public health, sometimes you do encounter those challenges where when you do face those bottlenecks, you don't have enough women in those leadership positions who are able to push and drive through policy. So I think going forwards, we saw with the COVID-19 pandemic, a lot of people who are the front lines of delivering care were women, but when it came to the decision making around the response, a lot of them were men. So I think pushing forwards, we absolutely, especially in the health sector, you need a lot more women in leadership positions.
Okay. I mean, you're certainly right, and I think this is one of the areas where a lot of women leaders that I've spoken to are very passionate about, including Dr. Ebere and Dr. Etiebet, very, very passionate about women inclusivity in global health. Dr. Chike, I know you started off as a clinician, but in transitioning to public health leadership, what challenges did you encounter as a physician who's trying to move into clinical to public health? For me, I knew one of the issues were that my family were kind of surprised that we've sponsored you to go and become a doctor, but now you're not seeing any patients. How has the experience been so far?
Yeah, I think it's you know there are not too many public health figures that we look up to in our country. So there are not too many role models um, that will say, okay, these are the models, the same way we celebrate popular clinicians in our context. And we've accepted many, disastrous public health situations in Nigeria to be the norm. When you think about the high number of women that die giving birth, the number of children that die in Nigeria from malaria, more than any other country in the world. These are just numbers, and it's hard to translate that into the emotions that will drive action. So I think some of the frustrations is just how to bring the challenges that we face to life, and to get Nigerians and Africans and people around the world to see that this is not normal. The situation we face in Nigeria, with so many unnecessary preventable deaths
Mm-hmm.
happening, cannot be normal and should not be accepted. And this is something I think arousing both political and emotional societal attention to these challenges is probably, I think, the biggest challenge that we face.
Before we proceed, I'd like to congratulate you both for the launch of the book, The Imperfect Storm or An Imperfect Storm. Um, it was truly insightful reading through it, and deeply resonated with me. And I hope most of public health professionals from the African continent will be able to place this in context. I was privileged to uh, join you during the lunch in at the pandemic center in DC. What I like about the book, it's in certain areas how you candidly reflected on the issues of leadership and how complex it is to be in the front lines of public health, and the challenges that we face as public health leaders in an area where there is inadequate infrastructure, and how we'll be able to successfully navigate that. So I know, like in chapter 7, that this story you tell about uh, your first response to an emergency, which was the meningitis emergency, and the fact that what should be a problem elsewhere wasn't looked at by the general public to be a problem. How do you believe that you know African leaders can prioritize health or public health in the national agendas? Dr. Chike, I'll begin that with you.
Yeah, no, thank you very much. Maybe just to set the scene for your listeners, this was a large meningitis, meningococcal disease outbreak in northwestern Nigeria. Literally, people were dying. It's a terrible disease. If you've managed a patient with uh, meningitis, you will never forget, because it's a painful transition, really. And when I went there, and with our team at NCDC, we're a young team, and we went and we saw the circumstances in which patients were being managed. And this wasn't hidden. The challenge, what I found most confounding, that is that pictures of patients being managed in very difficult circumstances made their way into the newspapers. I made several press appearances. I thought, in a way, that this would arouse the interest of people and the politicians, but there was almost no interest. So I knew we had our work cut out for us, in terms of, this was a disease for which there was response opportunities. We knew what we had to do, but we had to mobilize both the resources, the people, the energy around the response. And for some reason, this wasn't happening automatically. So I knew that, firstly, this whole idea that we are destined to a certain fate because of the circumstances of where we live
Mhm.
and our socioeconomic realities and all of that wasn't something I was willing to accept. So I pushed hard with the team I was working with to really highlight that this is not normal, and we had to reset the bar and not accept that to be the norm. So we published the findings from our response to that outbreak quite publicly, and we calculated the number of lives we could have saved if we had had the appropriate response within the time frame that we needed. And I think that really galvanized a lot of the work we did subsequently. That, you know, when you see people dying from completely preventable circumstances, that we as a society mustn't accept that as the norm, as just something that fate has brought onto us, especially in the 21st century that we happen to live in at the moment.
Yeah, it's such an interesting dynamic because most often than not, whether you are in the clinical setting or in a public health setting, those kind of pictures are very common in our workspaces, and it's almost like it's become normal. We've accepted it to be normal, but as you said, I think we should strive to improve on some of these things. Vivian, I know co-authoring an imperfect storm must have been an intense and reflective process. Can you share how your health communication experience influenced how you approached writing this book? And what were some of the key messages that you really wanted to ensure came through?
Okay. In terms of how my sort of like health communications experience came through in this book, for us, when we were, even documenting the response was not something that we knew how we would go about to do it. Um, I think back to how everybody at the onset of the COVID-19 pandemic was saying how Nigeria has previously overcome Ebola, that with COVID-19, we're going to do it all over again. And you just kept on hearing the stories of how that happened. But what was really clear was, thinking back to the Ebola outbreak, yes, Nigeria actually did not have as many deaths as other West African countries, which was, by let's face it, luck in the sense that when the first patient came into Nigeria, he went to a private hospital and was immediately seen to by a Dr. Stella Meyer at Adedefo, who unfortunately lost her life in the process, and we're currently we just finished celebrating 10 years since she passed away. But there were a lot of stories then about how Nigeria overcame and how COVID-19, we'll do it again. But there were never any stories that were documented about the experience of that response. So when the COVID-19 pandemic was unfolding, there was so much happening simultaneously, and the uniqueness of the fact that globally many countries were responding simultaneously. And listening to stories that Chikwe would share when he came home really framed in my mind a need to document this experience somehow. And there was no formal process in which it was done in terms of how we would eventually, release or produce what output it would be. So it literally just started us writing short, lines from when he came back every evening. He'd share his experience, and I just started jotting it down. And as I said previously, it was quite cathartic to just have the opportunity to write down some of the things he was saying. And very slowly, before you knew it, it wasn't every day I wrote things down, but on a lot of days there were things that were written down, and he would share. And very quickly it's took shape. And looking back and writing the book, there are things we kind of referred back to almost trigger our memory on a lot of things that were happening, that it's so easy to forget, because so many things were happening all at the same time. So that really was, I think, for us, the starting point of even thinking through about this book.
Mhm. Yeah, that's I think that set the stage for a lot of the chapters and experiences that you showcased in the book. And I know for some people that kind of experience seems like far-fetched. So if you're a leader in or if you are responding to a health threat in maybe Nigeria or in Ghana, the expectations is quite different from elsewhere. I know in the early stages of the COVID-19 pandemic, I was leading the Baltimore City Health Department's response as a manager, and we had systems in place. We have, rooms, hotels for people who would go for isolation. We had, communication systems really set up. But that wasn't the case in Ghana. And in your book, you also made mention of inadequate infrastructure. Um, Dr. Chiwe, can you discuss or paint a picture of how complex it is to lead, public health efforts in such environments?
Yeah, Banda, you're right. We don't have a lot of resource for sure on the continent. But what we don't have in resource, we make up with the energy that we have in our people, right? And it's just a resource that we often don't use enough. So what I found is that if you provide leadership and you provide direction to people and you show yourself that you're willing to go the extra mile, that people do come with you, and they want to also shine, they want to deliver, they want to perform even with the limited resource around us. So we live in a resource constrained context. That's our reality. But I do think we make up for a lot of that with the energy of our people, the competence. And when there's a crisis, you see people mobilizing around that to lead our people out of it. So I think, if I reflect today on to me the biggest lesson I learned is when you see people, whether they're Nigerians or Ghanaians or Kenyans across the continent, uh, don't assume what you see when you
Mm-hmm.
see them maybe not acting at their best. Uh, Maybe what they're waiting for is an opportunity to unlock what they have in them. And once there's a way to unlock that and to provide them that avenue to shine, my experience has been, the people I met have been as good as you meet anywhere else in the world. But they don't always have the opportunity to give their best. And so I hope that what uh, the response, and that's ultimately what the most of the book is about,
Mm-hmm.
is demonstrating what is possible when you unlock the potential that many people have in them, even when they work in a sometimes difficult context.
Yeah, that's definitely true. Miss Vivian, I think another important theme is in the area of how we navigate cultural beliefs in in public health response or in public health discourse. In Ghana, one of the surveys that we did uh, really showed that people were not going for the vaccine because they thought that getting the vaccine would change their mind to vote for the incumbent party. So these are some of the issues we are dealing with. And reading your book, I've also come across a part where one government official attributes an outbreak to um, the wrath of God. Being in this space, how do you really navigate the intersection of public health and deeply rooted cultural beliefs, especially in the context of public health emergencies?
Hmm. I think, one thing, you mentioned the surveys that were done in Ghana. I mean, one thing that we did in terms of influencing or shaping the public health messaging during the COVID-19 pandemic, my organization, Nigeria Health Watch, joined the crisis communications team at NCDC. We were part of a larger team. There were many other organizations that were supporting the response, Corona MS, the Tony Blair Institute, including the core NCDC team, who literally were, very much leading the response. One thing we did in shaping the public health messaging was using data. Um, so there were many data points that we used to shape the weekly messaging priorities, as we called them. So, for example, NCDC had a call center which people called in to ask questions about COVID-19. So the questions people were asking, those were captured. NCDC had a rumor management tool which did a lot of listening to what people were saying about, different health issues. COVID-19 was just one of them at that particular time. It's called Tatafo. In addition, NCDC had a very, very vibrant social media platforms. By the COVID-19 response, there were over 1 million followers on Twitter. So all these data triangulation points, including looking at the weekly, upsurge of COVID-19 cases, now inform the public health messaging that we now kind of put out. So, for example, on a particular week, if we noticed a lot of people were suddenly asking, about COVID-19 vaccines, that it gives that if you take the COVID-19, there was that 5G rumor. We now had to use the different messaging platforms and tools to disseminate messaging. So, for instance, on WhatsApp, we would use infographics, videos, cartoons. Radio, we would now have different spokespeople go and speak on radio in different languages. So those multiple platforms targeted at different audiences really helped shape and ensure that when we are putting out public health messaging, it's aligned with what people are saying. And we're actually using different data points to listen and understand what is being said. And that really, I think, was very helpful in ensuring that the messaging, which was framed around a campaign called Take Responsibility, was better informed to be able to address some of that misinformation and miscommunication around the COVID-19 pandemic.
Yeah. Yeah, and I think it's certainly vital. You've highlighted a very essential component of health communication, that is real-time response, using uh, evidence or data to kind of shape your messaging in dealing with misinformation. Dr. Chikwe, so as you rightly said, that sometimes people don't value public health because they don't have role models to follow, or they don't have examples to show. And you've been one person who really inspire a lot of young public health leaders on the continent. You currently lead the WHO's Hub for Pandemic and Epidemic Intelligence. Um, in that role, what have you seen are some of the critical gaps in global pandemic preparedness and response? Um,
Thanks, partner. During the pandemic, um, I had to stand in front of Nigerians every evening to update them literally every evening on live TV. The whole country was watching, Nigerians all over the world, everyone interested in Nigeria. The many countries were shut down, not only our country. And so we all focused on TVs and internet and focused on the live broadcast, and I had to explain to people, you know, how was this virus spreading? Who was being infected? What are the risks? What did they do about it? And we just did not have the data to answer the very complex questions on spread, on impact, on morbidity, mortality that we had to, or what we should do about it. And this wasn't just me, it was a shared experience. If you look at the US, you can identify similar people on TV every evening. In Ghana, every country had someone responsible for explaining to the population what was going on, right? So this was a shared challenge. And so the work that we're doing at the WHO Hub for Pandemic and Epidemic Intelligence in Berlin is really responding to that problem. How do we collectively get better at collecting better data, analyzing that data better with the agility, flexibility, and using it to make better decisions so that we can have better precision on the decisions that we have to make every day. So rather than having to close down an entire country, can we have more targeted interventions at the source of emerging infection or at a population that is most at risk of severe outcomes from a specific new infection or old infection? And with better data, we're able to do that. Better analytical tools, better understanding of genomics, better understanding of disease dynamics, how it spreads in populations. And really, that's what the hub is doing. This is a long game. So some of it is around building new technologies, some of it is about bringing together professionals working in different spaces to think together. Some of it is about uh, organizing institutions, national public health institutions, to have new departments that understand artificial intelligence, understand
Mhm.
large language models, and how to use that to interpret data systems. Some of it is just about making sure that data systems are able to speak to each other and have the ability to connect. So it's an exciting set of challenges that we face, and I'm really proud to be at the heart of a team of colleagues that are trying to solve some of the hardest problems in the world today. So when we do face the next pandemic, which will inevitably come, that we're in a much stronger position to rapidly understand what is going on, assess the risk, define response measures, and support the world in rolling out these measures so that we're not faced with the tragic situation that we were faced with 3 years ago, where we had to interrupt so many aspects of day-to-day life around the world.
Yeah. And some of the issues that you've raised are very, very critical, especially in getting prepared for the next pandemic. And I know one of the areas that it's also becoming very mainstream is the issue of collaborative surveillance. So, given the importance of real-time data in managing public health crisis, how do you see African countries in particular becoming more actively involved in collaborative surveillance initiatives? What steps do you think should be taken to ensure that African countries are beneficiaries and also contributors to global health intelligence networks?
So Banda, one space you hear about what young Africans are doing in fintech, in all sorts of industries at the moment that are driven. Ultimately, all of these industries are driven by data, right? It's data analytics at the back end of all of them, whether it's fintech, whether it's all the mobile applications around the world. The question really is, how do we attract those people into the public sector? Because public sector salaries are low, conditions of service are low, and many young Africans are not aspiring to come into public service. So I don't for one bit doubt that we have the ability, the capacity to do the same things anyone can do around the world. Our challenge that is in a way unique to our continent is, how do we attract the talent that we need into public sector, into the spaces that they can drive this collaborative surveillance approaches. What is collaborative surveillance? It's bringing together the data streams developed for different diseases, whether it's wastewater surveillance, uh, indicator-based surveillance, event-based surveillance, population data, travel data, together to inform decision making. To do that, you need uh, data analysts, data scientists. We have them. The challenge is they're not streaming into the public sector looking for work because the incentives are not there. So our collective challenge really is to create the conditions of service in the public service, in the public sector, to attract the talent that we need to do the things we need to protect ourselves. And this is not unique to public health. It's the same challenges. Who are the people coming to work in security services? Very hard to attract talent into the security forces, to the justice system. And these are parts of government that the private sector cannot solve for us. You can't have the private sector do our judiciary or our security or large parts of health and education. We need the public service to work, public sector to work on our continent, and we need to attract the talent to do that. And that's maybe at the heart of the challenge of our generation.
Yes, yes. And I think you've highlighted a very important point, that we have the talents, but as you said, the incentives and the motivations are not there, particularly when, for example, we all see the kind of display in of our politicians in the public space. um it's 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 a difficult task, but hopefully we can get to a point where um those with the expertise, those with the talent are attracted back on the continent to really contribute to some of these amazing initiatives. So before we move on to the other segment, what really do you see are some of the most significant public health challenges that are currently facing African countries?
Like I write in the book, An Imperfect Storm, we write about a storm, and we really write about how Nigerians responded, how people working in the public sector did their best to respond. And I think while I'm extremely proud of that response, what really worries me is what we do when there's no storm, right? Um, you know, all these things that happen quietly and all the time in public health. The maternal mortality, the number of women that die in childbirth, the number of children that still get malaria, the number of malnourished children, the are dying of undernutrition or malnutrition, and then combined with the continuous evolution of diseases that are extinct in many parts of the world. The fact that people are still having cholera. We're not talking about new emerging viruses. We're talking
Mhm.
about old diseases like cholera. We're talking about measles, for which there's been a vaccine for 50, 60 years. So really, I think our biggest challenge is how do we raise the attention of our leaders to health? How do we get health onto the political agenda? How do we get people to vote politicians in and out of office because of what they do or do not do on the health of their people? Infrastructure is on the minds of people very much. Security, we have many challenges. Petrol these days in Nigeria is a big topic. And all of these are important. I'm not saying they're not important, but somehow in that political agenda, we have to get health just a little bit higher on the political agenda of our politicians on our continent.
Yeah, I agree with you on that. I think the prioritization of health, it's something that has to happen before we can see significant change in the way we respond to some of these emergencies or even some of these endemic um, conditions. So thank you so much for sharing that. Okay, so I think one other issue that it's very important that you've kind of highlighted um, is is how do we attract the next generation of public health leaders on the continent? That leads to a crucial area of leadership and mentoring. So my question to both of you is that what you've been in the leadership space for a long time. What strategies have you found most compelling in mentoring young professionals, especially from Africa? I'll start with Vivian.
Okay, thank you for that, Banda. I think one thing I found, leading an organization like Nigeria Health Watch, which, since its inception has evolved in terms of the work we do, is we actually have quite a young team. And I remember when, we relocated back to Nigeria and I started running Nigeria Health Watch. And I used to always wonder why a lot of the junior team members would, sit quietly in meetings and, you don't often hear, contribution. And someone pointed out to me that, culturally in Nigeria and often in many of our countries in Africa, we have this system of hierarchy where there's a power distance between junior and more senior members of a team. So you'd have a meeting and you'd have junior and more senior members of the team. And often it's the more senior members who lead and who dictate and direct the younger ones what to do, and the young ones sit and listen. And even our educational system encourages a system where, yes, there is a hierarchy. The lecturer or teacher gives you information, you, the student, taking that information, repeat it out. There isn't enough interrogation within even our curriculums whereby a student can put his hand up and say, "Sir, I don't actually agree with what you
Mhm.
said. Can you please, maybe this is what I think." That's almost unthinkable. So
Mhm.
when you come down to the work setting, you often have young people who are never really don't feel free to share their point of view because nobody's ever really asked them. They're used to the hierarchical structure. And something really tried hard to change, and it did, I think for me it did take a while, was creating that space where whoever you are, and this is what I always say to team members, I want to hear your ideas. I don't have all the ideas. Of course, I have more work experience, but I certainly do not have all the ideas. I actually want to hear your idea. So, creating a culture within an organization where, for instance, people call me by my first name. Initially, many people found it difficult, but I really want to take away that sort of power distance and create an environment where young people are able to share their views. Because when that happens, often you have people who have brilliant ideas and feel that freedom to grow. And it's only through enabling, members of my team to share their views that they themselves are able to see what they can fill and to really fulfill their potential. So I think one thing, I always encourage, and I think has worked for us as an organization, is creating a space, a safe space where people can make mistakes and learn and grow and take that experience into whatever future career they choose to go into.
Yeah, I think that is such a powerful message. Hopefully, we'll create that culture in most of our institutions to really help nurture the next generation. Dr. Chikwe, how do you think we can create more opportunities for emerging public health leaders? I know sometimes it's difficult for those from um, underrepresented regions to actually break through into the global limelight. How do you think we can create more opportunities for people who are really passionate about making impact?
I think we just keep pushing and bringing them in and supporting them to grow. You know, one of our biggest, I reflect, one of our biggest successes at NCDC was enabling the growth of so many young people. And I mean, one of the consequences of that, and I'm still not sure whether it's a good thing, whether it's a net positive or a net negative. Um, Many of them have left NCDC and have gone into uh, many organizations. But if I think about the number of colleagues that are working at Africa CDC, WHO, SEPI, are doing master's programs, PhD programs all across the world, they will all come back
Yes.
to push progress on our continent. So even though there's a short-term loss, if you want to perceive it that way, I am incredibly positive about the future because all of them are super motivated about contributing to Nigeria and to the continent generally into the future. So I think there's so many opportunities these days. Every time you look around, there's a new fellowship for emerging leaders on this and that. I think the world has woken up into this need to support the personal development of young and middle level colleagues working in our institutions. So there's an era right now of going to make the most out of these opportunities, whether you're in a short-term program, longer-term program, or just in a job. What we need to ensure is that they come back to work in the NCDCs, the MPACDAs, the NAFDACs, the Africa CDCs, the Ghana Health Service of the future. And really, so that's to me the challenge. I'm not too worried that people are leaving to seek new opportunities. I think that's the natural tendency. I did the same, and Vivian did the same, but we've all come back to contribute to our continent. You're doing something similar, contributing in many ways. So the key thing I'll tell young people is take every opportunity you see you can grab to develop yourself, and ultimately your heart will bring you back to the continent that we love.
Yeah, yeah. Um, hopefully, we have these kind of mindset imprinted in our leaders and also the next generation, to continue supporting people, to continue supporting what is really the future of our continent. Our last session is really letting people uh, get to know you more. Um, so I will start with some rapid fire questions that is meant to let people get to know you more. So I guess my first question is, how did you two meet?
Okay, over
I'll
to
let
you.
Vivian answer that question so I don't get into trouble.
you you can read about that in the book. Maybe that's a bit of intrigue. Maybe that would be a bit of intrigue. If people were really curious, they can read the book and find out how we met. So let's leave that on a cliffhanger. How we met.
Okay, okay, understood. Okay, so who is more likely to say yes when their kid asks for something?
Oh, I am. I can answer that straight up. My kids have me wrapped
I
around
think
their finger, sadly.
Okay.
I think she's right.
Okay. Who is the disciplinarian in the family?
Definitely
Um,
Jaguar.
I, I don't know. I hope I'm not all the time. Sometimes I am, but yeah.
Mhm. Okay. Um, what's your favorite dish if you're not in Nigeria?
Oh, stir fry noodles.
Hmm.
Uh, but I eat plantain whether I'm in Nigeria or anywhere in the world. It's the only thing I dream about.
Like fried plantain or
Fried, boiled.
okay.
As long as it's plantain, I will eat it somehow.
Okay. I know I'm gonna lose on this question, but I still have to ask it for my audience. Jollof rice, Nigeria or Ghana? Who does it better?
But not on this
Senegal.
show. Not, you're outnumbered. Uh, we must invite you to Abuja to come and enjoy the real jollof rice. Although I must confess, Vivian has a bias for Senegalese jollof rice,
Okay.
actually.
Yeah. Yeah.
The
I think
origins of
Senegalese
jollof
jollof
rice.
is quite nice.
Yes.
Mhm.
Yes.
But we must be proud of jollof in West Africa altogether,
Yes.
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 And I think that's the beauty of
Yes.
our region in the world is the incredible food we have on the West African coast.
Yes, yes. We have so much diversity in food and so much variety. Okay. So what do you enjoy doing in your favorite in your free time?
I mean, do you want the real answer?
Free
No,
time, what's
we
that?
struggle. I know we really struggle with free time, but we are lucky to work in a space that we enjoy, which is
Hmm.
a privilege that many people don't have. When
Yeah.
your work and life kind of merge into one very nicely, so we spend a lot of time also working that in a way that we enjoy, and yeah, but we travel a bit and enjoy time with our kids who are now growing, and enjoy seeing them evolve into men too.
Okay, awesome. If you weren't in public health, what other career could you pursue?
Vivian, you answer. You have. Uh,
Oh, if I wasn't in public health, what other career would I have been? Maybe a teacher, actually.
Mm-hmm.
Yeah, I think I've been a teacher.
uh, Interesting. I was actually thinking the same thing. So in a way, hopefully that merges into one, and we can evolve, find a way of bringing some teaching into the later stages of our career.
Yeah, that would really be good. Awesome. Um, what's one thing you still want to accomplish in your lifetime?
Hmm. Mm. One thing I want. Chukwa, you go.
No, it's funny we just talked about teaching because I really hope that the challenge with teaching sometimes there are not too many opportunities on the continent to earn enough to do it uh, to do it at the moment. I hope that uh, we can progress our careers to the point that we don't have to earn too much and we can use the last stage to share some of the incredible opportunities that we've had with the next generation.
Yeah.
Awesome.
Okay.
Um, what's the moment in your career that you're most proud of?
One moment. It's had to. There have been several moments, but um, so I'm not sure there's one moment
Mm,
that
I'd say
that stands out the most. Maybe you
mm,
you give it a go, Vivian.
I think for me, moments in my career and the work we do that I'm very proud of is when I see my team members who have left, who now become partners. I think, having that full circle relationship with people who started their careers in your organization, progress out of it, evolve in their own careers, and you're now working with them, but as a partner. For me, it's almost like seeing your child grow up and you're
Mhm.
now seeing them blossom. And for me, that gives me immense, personal pleasure because, for me, my team members are extremely dear to me. So for me, that's actually a moment of pride that I really take forward.
Awesome. Um, well, this is all we have for the fun questions. But before we go, Dr. Chikwe Vivian, could you share where we'll get, for those who are interested in getting a copy of An Imperfect Storm, where can they get some? For example, if you are in the African continent or maybe you're in US or Europe, where can you get a copy?
Well,
Yeah.
if
No.
you're
So if
in the
you go
Amazon,
ahead.
Japan. I said if you're in the
Yeah.
UK or US, Amazon. If you're in Nigeria, Chikwe, where do they get it from?
Yeah, in Amazon, there's an amazing book, a series of amazing bookshops, Roving Heights in Lagos and Abuja, or you gotta look for Masobe books online, do a bulk order, and get it for all your friends, your family, your students, and your network. And I think that's the what we would love the most. But whatever our goal is that this book sparks important conversations
Yeah.
around the world related to our continent.
Mm.
Awesome.
And I have to
Awesome.
also add,
Hmm.
this book was only made possible because we had fantastic publishers, Masobe Books in Nigeria, who took on our story and enabled us to tell our story with authenticity, through which we're really grateful to Masobe Books really for helping us get this book to where it is today.
Awesome. Awesome. Thank you all so much. Before you go, final words, Dr. Chikwe, final words and advice for early career public health professionals, especially from the continent.
Yeah, trust your hustle. That's what I'll say, but do it with heart. The path to success in public health is never straightforward. But just trust that hustle, but put your heart, your soul, and everything into it. The world will have an amazing way of conspiring to put you on the global stage one day.
Awesome. Miss Vivian, what advice would you give
I think
young?
Chikwe took the words right out of my mouth, quoting Jane Ashton's TED Talk, where she literally said, you have to believe in yourself, in what your goal is and what you're trying to achieve. And definitely, I think people should listen to that TED Talk actually. And yes, as Chikwe said, absolutely trust your hustle. It may be difficult, you may not see the end to where you're going, but just stick with it if it's something you really are passionate and believe in. And yes, it finally ends up working out in a way you least expect it.
Yeah, that's true, and that's a powerful way to end our conversation. Thank you all both. Thank you both so much for making the time to join me today and to share your experiences, the inspiration behind the book, and the impact that you're making on a global stage. We'll continue to follow your progress and get inspired by your journey. So thank you so much for joining us. I truly appreciate it.
Yeah, thank you,
And
Banda.
thank
Thank
you
you for
very
having
much,
us.
Banda,
Yeah.
for the opportunity.